my diatribe. Welcome to another episode of Let's Talk Diabetes with Nkirika, where I always share life-changing tips through a lived experience lens. So today I'm going to talk about diabetes and Ramadan and associated risk. So this is a continuation from an earlier video in our diabetes and Ramadan series. So there are three types of risk that individuals living with diabetes might experience if you don't have the right fasting strategy. So the first one risk factor is severe low blood sugar levels. So this usually occurs during the late periods of fasting, which is usually before iftar. And you should also note that this usually occurs in individuals who manage their diabetes with either insulin or sulfonylureas. So why does this happen? Number one, not eating enough carbohydrates. Number two, taking too much medications for the amount of carbs consumed. So how can we prevent this low blood sugar from happening? Number one, you need to alter the dose of medication with support from your healthcare professional. And then the second risk factor is actually severe high blood sugar levels. I know this is quite common in people who don't have the right fasting strategy. So this usually occurs after either the sahur or the iftar meal. So why does this happen? When you eat large meals during iftar, number two, if you're taking too little insulin or oral diabetes meds for the food quantity that you are consuming, and number three, reducing your medication without any medical advice. So how can you prevent this from happening? Number one, you have to try not to overeat at all the meal times and talk to your healthcare professional before changing your doses. Number three risk factor during the Ramadan fast is dehydration. So this is quite common in some countries who have with a longer fasting hour, or the climate is very hot, and this could also lead to low blood pressure and possible fainting episodes. So why does dehydration happen during the fast? Number one, you're not drinking enough fluids between your iftar and sahur. And number two, you're eating too much salty foods or drinking too much caffeine. And number three, you might be on diuretics or SGLT2 inhibitors. So these are some drug classes that take away excess fluids from yourself. So you need to talk to your healthcare professional if you're on any of these drug groups. So how can we prevent this from happening? Number one, you have to take enough fluids. Let's say 8 to 10 glasses. You evenly distribute between your iftar and your sahur. And then number two, you need to limit the intake of caffeine or salty foods. Remember to like, subscribe, drop comments, and hit the notification bell to notify you when the next video on Ramadan and food choices will be uploaded. I look forward to having that interesting topic of discourse. Bye.